The following edition of Connecticut Valley Views is made possible by Windsor Federal Savings, with offices in Windsor, Granby, and Bloomfield. Neighbors helping neighbors since 1936. Connecticut Valley Views attended the opening launch of the Connecticut Health Council in December at the Hartford Convention Center, and I'm pleased to provide you with our coverage, which includes interviews with Oz Griebel, CEO of Metro Hartford Alliance and host of the event, Bob Patricelli, co-chair of the council and CEO of Women's Health USA, and Dr. Robert Blendon, Harvard School of Public Health, who is the featured speaker, along with highlights from his remarks. We are here today for the Connecticut Health Council. This is an outreach by the Metro Hartford Alliance. I am with the CEO of the Metro Hartford Alliance, Oz Griebel. So I'm going to be asking him a few questions about what we're going to see today. Now, this Health Council was founded in 2012. Is that correct, Oz?
Yes, we just started it. Yes, that's correct.
And what was the catalyst for it? What do you see as the initial first step?
Well, the catalyst, just to put it for your viewers, put it in context, we started something called the Connecticut Insurance and Financial Services Cluster in 2000, ultimately got it off the ground in 2003, and have had a lot of success with that in a number of fronts. Our board and some of our investors have been encouraging us for the last several years to wade into the health arena, and obviously what we were looking for is the right role for us to play, not be duplicative or replicative of anything that anybody else was doing. And came across, with Bob Patricelli's help, a model that Nashville has used where the concept is you don't advocate for anything particular, you don't try to take positions, you don't necessarily work on workforce development as a group, you rather bring people under the big tent for networking purposes, relationship development, all using topics and speakers as the excuse to come together, with the overall goal that as more people understand the diversity and breadth of what we have in assets, that more people will be ambassadors for Connecticut as a center of health excellence.
Because it's been a center of insurance, or was
Correct.
known as a center of insurance.
And we're promoting it again. We're still the insurance capital.
Because that's going to tie in.
Correct.
I mean, the insurance, the health care coverage, that's all
No
going to be
question.
part of it. Now, it's co-chaired by Marty Gavin, President and CEO of the Children's Medical Hospital, and Bob Patricelli, Chairman and CEO of Women's Health USA.
Right.
Now, I understand those two have been driving forces to get Dr. Blendon to come today.
Right.
And he directs the Harvard Opinion Research Program.
Right.
How did you identify him as the good first one? It was Bob's idea, Bob Patricelli's
Well, the
idea?
irony is that the launch was originally scheduled for October 31st with Carl Zimmer, and that was the time of the storm. So the launch that was scheduled for October, that we moved here, we already had Bob Blendon committed to this date.
I see.
And Carl Zimmer's coming in actually next year because when the date
Sure.
got moved. So I think the beauty of what by launching this, maybe if we had thought about it a little more, maybe we should have done it after the election anyway. The fact that this came after the election, Bob's expertise, Bob Blendon's
Timing was
expertise
right.
on this was timing. So I mean, as you'll see in his presentation, there's one of the themes that he will emphasize is the need for collaboration and compromise on a lot of these health issues, because the country is very divided on things like the role of government, state and federal government in health care. Some people believing very much that
Right.
this should be under the total purview
Sure.
of government, others believing it should be more market driven. So we are, like we are in a lot of other things in this country, divided about what we should be doing. So the need to have people sit at the table and
Is very
talk this
important.
through is something that Bob will emphasize.
All right. Now, you have some more health care councils coming up.
Correct.
There are approximately about 7 more.
We have
do I
7 that are
understand?
scheduled thus far, right?
Okay,
And our
the
goal
next
is to keep
one's
January 18th with Ken Gronbeck.
Okay, and he is?
He's a demographer, and we'll be talking about the impact of aging on
Interesting.
a variety of topics, but particularly what the impact is of an aging demographic on healthcare.
Interesting. Now, the other programs in the Metro Hartford Alliance itself, what other programs do you have going on for that, not necessarily health related?
Well, the Connecticut Insurance and Financial Services Cluster, as I mentioned earlier, that's chaired by led by Susan Winkler for us and chaired by Jim Bedard, an senior executive at United Healthcare, has been out advocating at the Capitol on behalf of the industry, working on workforce development issues, looking at the best practices that other states have so that our sector can grow here. Another major initiative of ours is HYPE, Hartford Young Professionals and Entrepreneurs, which is targeted to age is sort of the, people say, well, how old do you have to be that you can't be in hype anymore? It's a
Sure.
state of mind.
Sure.
But it's about connecting people, giving them networking opportunities, giving them opportunity, identifying opportunities where they can contribute in various organizations around the area, and also professional development opportunities. So that's a major initiative. We do a lot at the Capitol. This is going to be a very challenging legislative session, as we all know, and so making sure that we're helping the governor, helping the legislature to make sure we do the right things, but that we're controlling spending, that we're looking at some of these systemic issues in our unfunded pension liabilities that have got major overhangs is a big area of focus for us. A lot of things on just broad, basic bread and butter economic development issues, talking to companies that are here, what do they need to make sure they grow here,
sure they stay here.
Stay here, what do they need to stay and grow here, and then helping DECD and others recruit companies here.
Well, now, the Metro Hartford Alliance, how has membership grown? How is it going? Are you larger? Do you grow every year?
Well,
do you add more businesses?
It's an interesting phenomena, not just in this organization, in our organization, but comparable organizations, chambers of commerce particularly. We're more of an economic development organization. What we're doing is we're serving as the economic development leader for North Central Connecticut, and we're the Chamber of Commerce for the city of Hartford. Chambers across the country, depending on where you are and what size your area is, are struggling. I mean, it's particularly in a recession, a 4 or 5 year recession, where every business is looking at their expense dollars. One of the easiest things to get rid of is something like a membership. We have been extraordinarily fortunate on all 11, 12 years we've been in existence. While some of our growth, the total number of members has declined, our dollars have increased. So the ability to start an event like this, start an initiative like the Connecticut Health Council, we've gotten extraordinary support. Yeah. And that to me is really the bigger indicator.
Now, what are some of the benefits of membership? I mean, obviously people can come to the lunches and so forth. Are there other things that are entailed?
Well, the thing that we've said to everybody is you have to drink the Kool-Aid a little bit that says an organization like this has to exist. Our mission is to see that this region competes, and that is the operative word, that this region competes for jobs, for capital, and talent. So part of the reason is you have to ask yourself the question, is it worth my supporting an organization like this, before you ask the second question about what am I going to get out of it.
So what can I do for the team versus
it's a little bit, don't ask what your country can do for you, but ask what you can do for your country. It's a little bit of
a Tim Tebow.
Yeah, it is. It is about
attitude.
that. Now you still have to, we say to anybody who comes in as an investor, we need your check, we appreciate the check, but you will not get anything out of this organization if you don't come to events like this, because that's where you're going to build your business, and that's what we want to make sure we want every investor to be highly successful, because that means that we're helping to do our job.
Well, you certainly are a great leader of doing that. You have been for some time now.
No, thank you, Susan.
We appreciate you taking the time
for
this great presentation. I am going to mention the website.
Yes.
It is metrohartford.com.
Right.
And for the Connecticut Health Council, it's is ConnecticutCT.healthcouncil.com.
Right.
All right. Well, thank you very much, Oz.
Thanks very much.
All
Always
right.
a
Thank
pleasure.
you.
The president's voters, bottom line, they want more government in health care. Just so a few of us remember history, Bob Petrocelli and I remember when Richard Nixon actually talked about giving block grants to states too. What did Obama voters say? Hell no, I don't want anything to do with that. And I just want to say one thing, I am required. In health policy, people are very polite and they don't like to mention abortion as a major political issue in the United States. If you are in elections, abortion is an unbelievably important issue. Actually was the second issue in this election, incredibly important for the president's side. Why in the last 90 days would nobody talk about it? Very simple, because everybody voted on it was a Democrat. Speaker Boehner was saying we have to deal with entitlements. Let me give you an easy warning. As long as you're up here about entitlements, a lot of people shake their heads. The minute Granny is getting something different on their Medicare, very different set of discussion. Here is the most significant thing dealing with the expansion of Medicaid. The Supreme Court surprised all of us. Instead of wrestling mandates to the ground, that would be the great decision. At the last minute, particularly, and he's a Harvard Law graduate, I have to be very respectful of that. What does he decide? He decides, well, the mandate should go, but by the way, not mandates for states to expand Medicaid. Take a look at the fun of fiscal cliff for this. So turns out the core president voters think that you can solve the fiscal cliff without going much near healthcare education. They're going to prove to be wrong, but if you are a legislator thinking about running 2 years from now, and they are your voters, you are going to have a tough time. So we asked people who are voting, how about large future cuts in Medicare and Medicaid? And so the thing, if you're in the politics of this, is the most bipartisan thing from a voter point of view is people are very reluctant to go near really big cuts in Medicare. So I'll just give you a hint. In things that are very unpopular, everything that deals with Medicare is like making people eat spinach. For that, the two that are least unpopular, please don't quote me as he says it's popular, is moving the retirement age. And Nancy Pelosi would be quite angry if I was here, because she doesn't think it's popular at all, but it's more tolerable. And asking anybody upper income to pay more. But I want to go back to Connecticut here a second. The Massachusetts bill got off the ground because an incredible range of civic leadership made a commitment to be involved with this. There also was an incredible amount of compromise. There were moments that the business community was going to walk away from that table over and over again.
I am here today with the featured speaker, Robert J. Blendon. He is the professor of health policy and political analysis at Harvard Kennedy School. You are an award-winning researcher, as I understand it, and you direct the Harvard Opinion Research Program. What does that entail?
It entails trying to understand how Americans across the country feel about important health and social policy issues. Essentially, I give voice to people's experience and lives and look at the implications of what they feel, how they vote, on the kinds of things that happen in the future in the country.
Now, Professor, who would come to you? You obviously have various groups that come to you to get your opinions on your polling. Who would that be, say, in the course of a year?
Many journalists ask my view. They want to know what people who read or listen to them think and believe and what they understand. Many people in politics who want to know what voters in their districts think about health and social issues. And you wouldn't think they'd come to a professor, but because I'm involved in looking at so many surveys, I really try to understand how people think about the news every day, the issues they face in their lives. And many leaders of health and business organizations who live lives where they actually don't have a lot of contact with many people, and they want to know what's going on and what do people worry about and how they feel about this, because it affects their own decision making, but their lives they don't have a lot of direct contact.
They're behind the desk and
right.
Not on the street.
And so I know many people would say, well, you wouldn't expect a professor to do this, but I've been long-term trying to understand what goes on in people's lives and how they view government and healthcare and their physicians, and trying to help people who deal with them have a much better understanding of what's on their minds.
Well, now, we're looking today here at the Connecticut Health Council. This is going to be a template going forward, I would think. Are there other states that have started this type of initiative?
Well, there are a number of states that are trying to bring civic leadership together with the health groups to talk about the big issues that they face. This whole world is very fractured and divided into tiny little silos, and as a result, we don't make progress on things. I mean, most people are so frustrated every time they turn on the radio, nothing happens.
The wheel.
Yes, people are fighting with each other rather than trying to do this. So groups that try to get together very largely from all the groups that could be affected by the decision making, and we have to have people who represent average patients and consumers start dialogues so programs can work. And
you're organizing all the information,
or at least in trying to help them think about that. And the new law passed in 2010 by the President and Democrats of Congress is very complex, and for people it could really work out very, very well, or it may not. And it really involves with leaders figuring out how these things would work, and physicians in hospitals, and people want to know how to enroll.
One glove fits all,
It is not. not. And for either businesses or people who are going to be purchasing different insurance or to get subsidies, it could work or not work for them, and it really depends how it's structured.
Yes.
And you have to start people talking to each other to have any chance of making these things
Come to
work.
a logical conclusion. Well, I'm going to take a couple of comments that you made out of context from your presentation today. You said there's no such thing any longer as the average person. Do you view that as a good or a
As
bad thing?
average voter.
Voter, all right, voter. And so how did we come to that? Because you referred to the fact there used to be a neighbor and a neighbor would have the same thing. How do we come to such a diverse group?
We have managed to divide ourselves in political parties in ways that people feel very different about the issues, and they join a political party. For that. Secondly, there's been a phenomenon in the United States that's very surprising. People have tended to move in communities where people share the same views on politics. Now, it's not one-on-one, but if you actually look at how votes go on, how people feel about issues, they have moved in communities. And when you live where nobody disagrees with you, what happens is your views become more strong.
This is true.
And
Birds of a feather.
and even on the media, there are much more media which has a partisan slant one way or the other. And so people who had a view just listen to the radio or TV station that reinforces their view.
This is true.
Rather than we used to have to listen and find out that there were different perspectives on this. I can turn on anything tonight and it reassures me. They will say what I believe. And that has led to a country that's quite divided and voters that are very divided and
polarized.
And in a way that I
never
think has
happened before.
not happened or not happened in probably 100 years. And I am one who thinks this is not good for this country.
So that's why I said this is a good or a bad thing.
No,
Yes.
I think it isn't. I think communities right through the country face a lot of very difficult issues that are going to affect us in the future, and we have to have the ability to speak and work on them and compromise. And the fact that I will feel so strongly about my stand that I can't reach any agreement is a guarantee that we're not going to do a lot.
Yes.
About things, and it doesn't matter if it's healthcare or schools or some of the environmental
And
issues.
progress can't be made.
It can't be made. And
We're tangled up in our own underwear, aren't we?
and we are.
Yes.
And that's very serious. So when I look at the divisions, others say, well, that's great, people have different views. I just worry that the country has to move forward, and clearly on health care. It costs too much. There are all kinds of problems with the service. We have to be able to find a way, regardless if I got up in the morning, I'm a Republican or Democrat, I can reach
Yes.
some agreement about how it's going to be less costly in the future and
Yes.
how I'll have some secure coverage. And we just can't battle this out year after year, or what's going to happen is people are just going to suffer because they won't make any progress at all.
Now, there was another comment that you made. You said that the majority of voters, the ones that voted for President Obama and re-elected him,
Right.
you said that they are more comfortable with a federal government versus a state government. Is that because they view the federal government as the bigger, better, has the more dollars?
Yes.
Daddy, is that
so
the deal?
well, I think they people who tend to want the federal government to do a lot more in health care are people who are very pleased with Medicare and think that the federal government can fix these problems, and that states, not that they're not adequate, may not be able to fix these problems. Others think that they, in their own minds, they think of schools, they think of a lot of problems that the federal government, they think, actually made worse. And so they say to you, I just don't think they can do this. They don't understand my part of Connecticut. They don't understand what the history of Hartford has been, and they make all these rules and regulations in Washington, and it's very hard. But most of the president's people have a sense that the health care thing could be fixed nationally, and I think they base it on, well, Medicare for a lot of them works okay, and it is a lot of federal guidelines, and maybe it could work that way here. But there's a huge division because others on the other side of the aisle just feel it's not going to work well.
It's not going to work. The bed has been made larger,
Right.
and the blanket isn't going to cover it.
Right.
All right, now polling numbers, you say they're so diverse. It's such a major subject for healthcare. Who should manage it? Critical conclusions that we need to come to.
How do you arrive at a final conclusion to someone who's asked you a question? You have all of this polling, you have all of these diverse opinions. How do you give someone finally at the end of the day, here's your answer for you?
Well, so the answer at the moment is that if I'm going to run a Republican primary and run as a Republican, I, in today's world, have to pay a lot of attention to what Republican voters think. If I'm going to be running in a gubernatorial as a Democratic candidate in Connecticut or something like that, I have to pay a lot of attention to Democratic views. So at the moment, what people really want to know is where my people are.
Sure.
And some people who might move over. But basically, they become less interested in what other people think.
And
it's
the
only,
answers you give them may
Yes.
not be what they want to
want to
hear.
hear,
either.
right.
They may have to take a slightly different stance.
Yes.
Move more to the right, to the
Yes,
left, to the center.
and so every time there are budget problems, people talk about, we all know we have to sacrifice and everything, and many families are very dependent on Medicare or Medicaid or Social Security, and they're nowhere near as willing as these people talking on television
Sure.
to the sacrifice. And so my role is to say these are going to be very tough. These are not going to be things that you just make a pronouncement about and are going to happen and people are going to be very
And
quiet.
by Friday, we're all set.
Yeah,
It's
right.
all
These
done.
are going to be very tough issues for people
Yes.
in government. Now, they're elected and they have to face these issues, but what I tell them is they could be tough. And it's not just that, somebody's stubborn. It is that people really feel that we don't have to go some of these directions.
Now, I noticed you talk about a lot of serious subjects, but I did feel you do keep an air of humor in your work. Is that because it gives you some sense of, keeps you sane?
Yes, absolutely. If you're really going to track American politics and
Yes.
healthcare, and all, you need some sense of humor because there's an irony. We do things that over a long time make no sense.
Sure.
And so, in a sense, I find myself laughing at these things because if people actually thought about some of the things we were doing, they would say this is ridiculous.
Yes, of course.
For this. So I take it more lightly. It's the way we are in our stage of politics here, and
I think you make it more palatable
Yes.
too, frankly.
Yes.
A lot of serious numbers and
Yes,
things, and
right.
you make it more palatable when people can take it with
Right.
a sense of humor. There's a sense of friendliness.
Yes, right.
User-friendly, if you will.
Yeah, and that is the purpose, to help people sort of think where we are so they can act themselves. They can
Sure.
look at the situation, they watch TV and say, now I know why they're behaving the way they
The
do.
pill goes down a little,
And
a little bit
you
more
know, if
easily.
I want to be involved in changing things, I have to deal with this problem about how some people actually feel,
Sure.
that not the same way I do.
Do your numbers and do your polling numbers and the information that you gather, does it ever change your own personal views? Are you influenced by your own information?
Yes. So when you study the lives of people, you at times worry about the things that they worry about, where many experts worry about other things, big changes. So in healthcare, if you're an expert, you always talk about how much of the economy goes to healthcare and everything else. And I get more sympathetic with people who are just worried about paying their bills and getting care that they think they need for their family. So what they worry about, you end up worrying about
Yes.
more than most experts do or professors.
Yes. Well, you are in a most interesting field, and I am going to give the website to kind of follow up on all
Good.
of this. I believe correctly it would be www.hsph.harvard.edu.
Right, absolutely.
Well, I want to thank you very much
Thank
for
you
your
very much.
time. Thank you.
You're right.
We enjoyed you. All right, well, we have just finished speaking with Dr. Blendon, and we are now going to speak with the gentleman who actually brought him to the Connecticut Health Council, and that is Bob Patricelli. He is the co-chair of the Connecticut Health Council, and he's also CEO of Women's Health USA. Pleasure to speak with you, Bob.
Thank you, Susan.
Now, a couple of things you mentioned when you were giving your presentation. You said that Nashville was it the first area that started this health council business? Was that the area? And you said you wanted to be competitive and be better than them.
Well, that's right. All of us who've been in the healthcare world know that Nashville has, over 20 or 30 years, spawned an abnormal concentration of largely for-profit healthcare companies. And it really started because they're very big hospital companies. Hospital Corporation of America and others spun out people and they mentored those people, and their progeny started lots of other companies, and they attracted investors, and they formed the council after a while to permit all those companies to continue to network and to learn together and to feed off each other. And so I don't know if they were first, or I don't know if they're the only ones, but they are by far the most important example of a successfully functioning, self-fertilizing healthcare cluster in the country.
Well, when you first started this initiative, did you approach actually the Metro Hartford Alliance? Who was actually the catalyst? What was the catalyst for the first step, and who said this is what we need to do?
Well, therein lies a tale. Oz Griebel asked me to make a presentation a little over a year ago to one of their economic development summits about healthcare as an economic driver for Metro Hartford. And I gave a talk in which I said, well, look at all the healthcare resources we have in Greater Hartford. I wasn't talking about the state at the time. I said, why, we should be the Silicon Valley of healthcare here. Mm-hmm. And then I said, but we can't be because Nashville is. Mm-hmm. And then I started showing actual slides from the website of the Nashville Healthcare Council, and most people were not aware of it. It kind of took people by surprise, and of course it got our competitive juices going. So out of that, I give Oz Griebel and the Alliance great credit. They picked right up on the idea and said, we can do this. And here we are.
Now, the objectives for the Healthcare Council obviously entail taking all of the resources in Connecticut. So we're talking about hospitals and who else? What do you see as the leaders and then the other people you can pull into this?
Well, healthcare is, of course, a huge business in this country. It's the largest economic sector in the country. And we intend to be all-inclusive, so it's not just health insurance companies that we're most famous for in Hartford, but it is all the hospitals, largely not-for-profit in this state. It's the academic institutions, it's the pharmaceutical companies, it's biotech, it's all of the physician organizations, it's the whole spectrum. And our difficulty, certainly up to now, is that we all behave as if we're in silos. And we're not talking together. We're not even talking to our closest friends and colleagues in the other companies, although we may be working 10 miles apart. Sure. Because there hasn't been forums that really bring us together.
And perhaps everybody is on a day-to-day basis. They're all taking care of their own things, and they don't see the reasons to work together.
Exactly, but it would be so much more efficient if we did some things collectively. For example, there are 10,000 pages of new regulations coming out on the Affordable Care Act. Can't we have some forums where we learn about what's in that together? Can't we ask questions of each other and somebody will know an answer? And I mean, we should start to behave like collaborators.
Well, Bob, you certainly have been a leader in this area. They acknowledged you today for having brought in this first speaker. I think they have several more forums coming up, but we appreciate you giving us the time to talk about it, and I certainly hope I can get an interview that we can pursue this further.
Thank you, Susan. It's an honor to be with you.
All right.
We hope that you have enjoyed this program, and I encourage you to see Dr. Blendon's entire presentation on our website at www.ctvalleyviews.com. Our thanks to Windsor Federal Savings for making this program possible. Neighbors helping neighbors since 1936.